Hello, everyone. This is Amy Hagel, Shine Liaison at Senior Connection Center. In today's edition of Medicare Mondays, we have Michelle, Shine Volunteer and Local Coordinator Assistant from Polk County, covering the topic of Medicare and Tracker for Life. So let's start with the basics. What is Tracker for Life?
Hello. TRICARE for Life is a health insurance program provided by the federal government to active duty and retired military personnel and their family members. There are many different TRICARE programs. TRICARE for Life, commonly called TFL, is a program for Medicare eligible military retirees who have served at least 20 years active duty and their dependents, and it acts as a supplement to Medicare, typically a Medigap, what we call a Medigap. TFL covers your Medicare cost sharing, deductibles, coinsurance, and co-payments. TFL may pay when services are not covered by Medicare or when you have used up your Medicare benefits. However, you may also have to pay a deductible if you're using TRICARE if you've not met the deductible criteria. TFL coverage and cost sharing rules also apply.
Yeah. Is there a monthly fee for premium, monthly premium for Tracker for Life?
There are no premiums for TFL except for the Part B premium, and uh, a beneficiary must be enrolled in Medicare A and B to enjoy the TFL benefits. So you are eligible for premium free Part A. You should sign up for Medicare and enroll in Medicare Part B to continue receiving TRICARE benefits when you are no longer on active duty as a service member or covered by an other active duty service member. And after enrolling in Medicare, you should automatically receive your TRICARE benefits through TRICARE for Life. I would like
Mhm.
to specify here, though, that veterans need to make sure that they're enrolled through the DEERS program, they and their families, in order to automatically be enrolled in TRICARE for Life once you become eligible.
Good advice. Do you need to add prescription drug coverage if you have Tracker for Life?
Um, the TFL also offers a pharmacy program that provides creditable coverage. In other words, it's comparable to what Medicare would provide if you were enrolled in a Part D. So it's
Mm.
not necessary, but you may choose to delay your Part D enrollment without penalty and continue using TFL's pharmacy program if you find that the TFL pharmacy program is not meeting your needs. If you are eligible for extra help, and again, that's income and asset based, you may want to consider enrolling in Part D. The drug copayments for individuals who have Part D and extra help are typically lower than the copays in the TFL pharmacy program. However, TFL's formulary may be broader than the formularies of Part D plans offered in your area. You may also want to keep TFL's pharmacy program if the plan covers your drugs with no or fewer coverage restrictions than available through Part D plans. The TFL pharmacy program may also cover medically necessary drugs not in the formulary for higher copays. Typically, the drug plan, comparable drug plan to Medicare Part D, is through Express Scripts if it's through the TFL program. It's not really considered a Part D program. So when you receive those benefits, for example, if you're receiving your immunizations, your annual immunizations, you must go to a TRICARE provider.
And when it comes to payment, who becomes primary?
If an individual with TFL does not enroll in Medicare Part D, their Part D plan pays primary to the TFL pharmacy program.
Hmm.
Let me repeat that. If an individual with TFL does enroll in a Medicare Part D, their Part D plan pays primary to the TFL pharmacy program. We can't bill two government entities at the same time.
Hmm, that makes sense. So, is there a penalty if you're not ready to enroll in a drug plan right away?
No, because it's creditable coverage, which means comparable to what Medicare would provide if you're receiving TFL benefits. Individuals with TFL will not pay a premium penalty if they decide to enroll in Medicare Part D at a later date, since the TFL pharmacy program is considered, again, creditable coverage.
Well, thank you so much for joining us, Michelle. And yeah, in this video series of Medicare Mondays, please contact your local Shine SMP program for anything related to Medicare, including Medicare fraud and abuse. Our Shine volunteers and Senior Medicare Patrol are here to help. You should call 1-800-963-5337, specify your county, and you will be connected with your local Shine SMP program. You can also reach us at florida.shine.org. Well, thank you again, Michelle.
My pleasure.